Hey everyone, welcome back to another episode of Tachy Tuesday. Today we're going to be learning all about atrial flutter. Atrial flutter is an abnormal cardiac rhythm where the atria of the heart contract faster than normal. The ventricles are unable to match the speed at which the atria are contracting, and this arrhythmia reduces the heart's ability to pump blood. Okay, let's go over a few characteristics of atrial flutter. Your rate in the atria is going to be between 240 and 320 beats per minute, so really fast. And your ventricular rate is usually around half of that, so 60 to 160 beats per minute. So there's different conduction rates with a flutter. You may have a 1-to-1 conduction rate, 2-to-1, so for every 2 flutter waves you have 1 QRS, or you may have 3 flutter waves to every 1 QRS, and typically it stays pretty regular throughout. Your P waves are actually going to be sawtooth F waves, so they kind of look like shark fins, but they're also referred to as flutter waves. Your PR interval varies greatly, and your QRS complexes are typically normal. A few causes and risk factors include coronary artery disease, a previous heart disease or heart injury such as an MI or open heart surgery, or technically any kind of surgery to do with the heart, drugs, stimulants, alcohol use, diabetes, hypertension, if you've been a smoker in your life, if you have lung disease, and any other underlying health issue. Some signs and symptoms that you may be experiencing atrial flutter can include chest pain, dizziness or syncope, palpitations, fatigue, difficulty breathing, or blurry vision. So those are just some of the signs and symptoms that have been reported with atrial flutter. And some of the possible EMS treatments that you may see out in the field could include, of course, getting a 12 lead, giving oxygen, getting vitals, starting an IV, and mainly treating your patient. How's your patient presenting? Are they symptomatic? Are they not symptomatic? You could give diltiazem, verapamil, which are both calcium channel blockers. You could give a beta blocker, possibly amiodarone. If it is serious enough, you can cardiovert your patient. But overall, it just boils down to treating your patient. Make sure you treat your patient, follow your protocols, follow ACLS, etc. Just so you see in this picture, I included a few different conduction rates. So we have our 2-to-1, 3-to-1, and 4-to-1 conduction rate, just so you guys can see it. Thank you guys so much for watching, and I will talk to you next week. Bye!